From the Mumbai studios of Republic TV, it's time for The Debate.
Debate at 9, powered by Sarah.
Good evening and thank you for joining us on The Debate this Monday evening. My name is Niranjan and I'm filling in for Arnab Goswami, who will be back on the show very, very soon. This evening, Twitter has been served a notice, and having given ambiguous replies, the Delhi police tried to issue a second notice. They were at the Twitter offices in both Delhi and Gurugram, but they failed to issue a second notice as they didn't find anybody at the Twitter India office. Social media platforms are on notice. That's our top focus. But on the debate tonight, debate number 1, the pictures from Hisar in Haryana. The pictures from Hisar in Haryana throwing up many, many questions on gatherings. Thousands and thousands have gathered defying India's fight against COVID-19, and it's a big concern. We have some medical experts tell us the dangers of such a gathering. Debate number 2, government reading the Riot Act to Twitter. Social media platforms are on notice. That's our top focus at 9:15 p.m. and at 10, our dedicated COVID broadcast, the only channel every night at 10 p.m. without fail, getting you reports on India's COVID fight back. Our coverage from across India's heartland continues. Here are the headlines. Government reads the Riot Act to social media giants, reminds them of compliance of Indian laws. Delhi police team reaches 2 offices of Twitter to serve a notice over the case of manipulated media tagging.
कोविड अप्रोप्रिएट बिहेवियर यानी कि हम वो सिचुएशन जहां पर कि इन्फेक्शन स्प्रेड हो सकता है, जिन इस पर काम करें तो टू दैट एक्सटेंट हम इन्फेक्शन के स्प्रेड को कम कर सकते हैं.
Central panel says India can evade the third wave with a strict enforcement of COVID protocols. But speaking about protocols, the pictures that is sending shockwaves across India, thousands of them marching to lay siege to the district collector's office in Hisar, Haryana. Global report hints at Wuhan cases in November 2019. The first cases of COVID-19 possibly in 2019, November. Dr. Fauci now backing investigation into COVID origins. And states on the East Coast bracing for Cyclone Yas. Union Home Minister reviews the situation. Well, for the last 17 days, India has witnessed a consistently downward trend in the number of COVID-19 cases. And at such a crucial juncture when every citizen, every state is trying to bend the curve, some groups are compromising India's fight with super spreader events. The same super spreader events that political parties talk about but are not talking about tonight. Here's what happened in Hisar, and then we have medical experts tell us the dangers of such huge gatherings.
174 kilometers from the national capital in Haryana's Hisar, thousands marched to the district collector's office to lay siege.
This is exactly the situation at the Hisar toll plaza where I am reporting. From here, it's around 20 kilometers which is left when we are to reach to Hisar. But the situation could be clearly seen. There are numbers of farmers who are still again on the road. We have seen the same kind of situation on 26th of January in the national capital. And now again, this kind of movement in such a pandemic could be clearly seen on the roads, and that's from the Hisar toll plaza.
The repeated appeals of the administration on following COVID protocols and calling off the protest march went unheard.
मैं इन 12 विपक्षी पार्टियों से पूछना चाहता हूं कि आपने एक बार भी उनको वैक्सीनेशन करवाने के लिए कहा, उनको कोरोना का टेस्ट करवाने के लिए कहा।
At a time when the entire nation is fighting COVID, some protesting farmers try to jeopardize the fight with no consideration of COVID norms. Shockingly, they have political support.
Farmers have decided to observe 26th May as Black Day. They are going to raise black flags in the whole of country. All opposition parties are supporting this protest.
Government panel has clearly stated that COVID protocols could help us evade the third wave.
जहां एक स्थाई पर वैक्सीनेशन का कार्य देश में किया जा रहा है, कोविड एप्रोप्रिएट बिहेवियर पर भी हमारी उसी मोमेंटम और उसी सुचारू रूप से आवश्यकता के अनुसार हम काम करते रहें।
Can we allow India's fight to be compromised, especially at a time when India is on the path of recovery? Let's debate.
And joining us on the debate this evening are Padma Shri Dr. Harsh Mahajan, who's the founder of Mahajan Imaging and president at Nat Health. Dr. Hemant Thakkar will be joining us in just a few minutes. But Dr. Harsh Mahajan, I just want you to tell our viewers a little bit about why we should all be careful at a time like this. Now, specifically, without getting into any politics, nothing. We just want to talk about the pictures that we saw today, and we were actually shocked in the newsroom when the pictures came in. And I'll play those pictures, and you can just tell us why at a time like this it's important for us to, as a nation, ensure that COVID protocols are maintained. Dr. Mahajan.
Thank you, Niranjan, for having me on the show. And I must say the pictures are not only shocking, they are also very disheartening to me as a medical man, because we've seen the devastation in the last 2 months that has happened in this country, and more so in North India, specifically Delhi and surroundings, Haryana, Punjab, parts of UP. And when we see these pictures, unfortunately, we see that there's hardly anyone wearing a mask. They're all sitting close to each other. And in fact, there's a lot of slogan shouting that's happening. All of these actually tend to increase the spread of the virus. We also now know that the virus is the new mutant, the B1617 variety. Out of the 25,000 odd that have been sequenced in this country, about 5,000 plus are of this variety. And this we know is more contagious, more infectious as compared to the Wuhan virus, as well as the virus that was first found in the UK, the B117. Seeing the devastation, seeing the fact that there was so much problem in finding a bed for those who were sick in the last few weeks, if we haven't learned a lesson from that, I don't know when we will. Thousands have died in the last 6 weeks. And these super spreader events, especially when they come from different parts of the state, different villages, they go back to their homes. Even if they don't have the disease or the symptoms, they may be asymptomatic spreaders of the disease, and they would infect their families. We've seen that in this second wave, because it's more infectious, the virus, whole families have got infected. And even if the younger lot were to have mild disease, recover quickly, or be asymptomatic, the elderly in the family would get affected, infected, and they may not be as lucky and survive. We've seen also during this wave, younger children as well as the younger lot have also had relatively serious disease. And so all in all, I say this has to be stopped. This has to be restricted. The least they can do is follow COVID appropriate behavior, do adequate masking, keep some distance as much as they can. This is just not done.
Yeah. Thank you for saying that, Dr. Mahajan, because you know what happens is sometimes when you speak the obvious, and I remember, you know, when the Kumbh happened, and we watched it that morning, and I remember that we said that it is a concern, the crowds are a concern, and yes, they acted. But in this particular case, I'll tell you what's happening. Now, we spoke to some of them. Now, when you ask them why they're not wearing a mask or why they're not following protocols, many of them are being driven from villages to these protest sites, right? Now, they say there is no corona, COVID just doesn't exist for them. Now, they say that they're not worried, they're not scared, they have a larger cause. Now, it's a very dangerous trend, Dr. Mahajan, and the reason why I'm saying that is because on the 26th of May, they're planning a larger protest. Now, when you look at these pictures and when you look at the circumstances and the figures, now, what's your message to them?
I would say that they should not go ahead with it. It may seem that, from 4 lakh cases a day that we had in the country, we are down to about 2.5. But 2.5 lakhs is also 2.5 times the maximum that we had in the first wave. And it requires only a handful of people in a village to spread the disease. So the ideal situation would be if they can somehow, I have nothing against them protesting, but protesting in this manner, which is absolutely against all COVID norms, this could be a super spreader, and we could again come back to a situation where we are again helpless. And frankly, as someone who is involved in diagnosis and treatment of these COVID patients, I can tell you that the healthcare workers are fighting day and night. They are exhausted. And if this were to again go up, it would be catastrophic.
Yeah. And I want to read out some numbers before, we're also waiting for Dr. Hemant Thakkar to join in. But let me tell you the numbers this evening as we broadcast the debate tonight. In Delhi, there are 27,610 active cases. I'm reading out the numbers. 27,610. After fighting hard, the number of cases have decreased by 3,698 in the last 24 hours. Now, let me talk about Haryana. 42,816 cases, active cases, reduced by 5,177 cases in the last 24 hours. Let me now talk about Punjab. 57,505 cases, reduced by 3,698. Now, this is the situation. And in Chandigarh, the number of cases are 4,874, has reduced by 391. Now, the thing is, Dr. Mahajan, you've been on this show and we've been talking about, the number of cases, the spike, what needs to be done, the COVID appropriate behavior, medication. We were debating at a time when we had 4 lakh cases. Today we have less than 2.5 lakh cases. And we are looking at a situation where 1.5 lakh, 2 lakh people could gather in the next few days. Now, that's what we are being told, that this gathering is not going to end. Today it was in Hisar. Tomorrow they will be back at Singhu and Tikri borders. Now, would the medical fraternity also appeal to politicians to come together and ensure that somehow we convince them to push this, if not end it?
I wish politicians would listen to doctors. That has hardly been the case. I would, appeal on behalf of our fraternity, because at the end of the day, if you see, apart from these suffering patients who have lost their lives, a huge number of doctors, nurses, healthcare workers have lost their lives in this fight against COVID for no fault of theirs, just for doing their duty. And if such an event were to happen again, these numbers may be smaller than what they were 4 or 6 weeks ago, but these are still huge numbers that you just read out. I mean, these are numbers which are more than most countries have. And we are talking of each state. 57,000 in Punjab is not a small number of active cases. So I would appeal, for whatever it's worth, that please have your protest. You may have your point of view, but at this point of time, when we are actually going towards a phase where the numbers are coming down, where the hospital beds are getting available, kindly don't rekindle the fire so that it takes over again. and we are in a bad position.
Yeah. Dr. Harsh Mahajan, Dr. Hemant Thakkar is also joining us live on the broadcast now. So let me quickly go across to him and get his perspective on this. Dr. Thakkar, good evening. We were speaking over these pictures that came in from Hisar in Haryana. We were horrified because, thousands of people, we don't have a number, but our reporter on the field tells us that it was in excess of 10,000 people who'd gathered there. And most of them on trucks, on vehicles. The pictures are on your screen. And most of them without a mask. And when we spoke to them, saying that they're not really afraid of COVID-19, they feel it just doesn't exist. Now, as a medical professional, now we've been talking about gatherings, all gatherings, rallies, political gatherings, and now these protests. Now, what is the message that you want to send out to them, Dr. Thakkar?
See, the message that I want to send out is that while I fold my hands and I tell them that whatever protests they have, whatever their offering they want to make, the COVID virus is not something that is selective and forgiving. The virus does not recognize a holiday maker, does not recognize a protester, or does not recognize anybody who is not socially distanced, except at times when it has to infect. So if you have groups like this, we will be going from the frying pan into the fire. We have just, so as to say, turned the corner of the second wave. And if you meet in groups like this, and that too without, first of all, meeting in groups is not done. Two, not wearing masks is a crime. I wish the government could make this a cognizable offense where you have to be arrested or you could be imprisoned. And after all the hardship that the country, the doctors, the industry, the oxygen people, the world and everybody has gone through, why must we fan the fire? And why must we allow and invite COVID back into our houses? You have a protest, you have something to say. Please say it through a different medium or say it in a socially distanced fashion. Whether 5 people say it or 500 say it or 5,000 say it, the point is to convey it. And in COVID times, please do not do this conglomeration of people. We know what we went through. We know what the country went through. We know the shortages of drugs, people dying of oxygen. Care for your family members. Care for your fellow countrymen. Ask not what your country can do for you. Ask what you can do for your country. And keep that in mind. All your other grievances can be addressed in a more COVID-appropriate manner. This is my request.
Okay. One last question to you, Dr. Thakkar. Now, there is going to be a bigger protest. Now, we are being told this was a precursor. On the 26th of May, there is a nationwide protest that different parties are supporting. Now, I won't get into the politics of it. But on the 26th of May, and today is the 24th, now there were thousands here. There could be lakhs of people who could gather. Now, as a medical professional, I just want you to tell our viewers what the threats are of such a large gathering. Simply put.
See, we have a virus which has mutated, not once but twice. It's a double mutant. We are already anticipating a third wave. Anticipation is different from invitation. Do we want to invite the virus straight into our midst? We lost the geriatric population. We lost the at-risk population. Now, do you want to also allow our children to get infected? I can only say with folded hands that I feel for you. I would like to hear your grievances. I share all your suffering that you have. But please do not give any more fuel to this virus. This virus is too smart. It's 2 steps ahead of us. And we've just about managed to turn the corner. We don't want another spiral. It will kill all the hard work that has been put in by the healthcare professionals and take the wind out of their sails. Please heed this request. It's not a warning, it's a request.
Dr. Hemant Thakkar and Dr. Harsh Mahajan, thank you for joining us